So I have been asked to speak on, some of the enablers for scaling up for adolescents. And here I would like to start with an anecdotal experience. I'm talking about a field visit which I made some years ago to an organization, and this organization had worked very well and for quite a long time in a village to develop these champions of youth who were, actually what we call peer educators today, and they were, boys and girls. And this is, I'm talking of a time when Tarkeske was not there, but there was this young band of people who were very enthusiastic in that village. So they were all talking about the things that they had done. They had actually cleaned up the village. They had talked to the parents about not doing early marriage. They had been mentors to a lot of other young people in the village, and they were talking freely about issues related to gender equity, equality, and even sexuality. So it was really, really very exhilarating for me to see. And then one of the girls in that group asked me a question. She asked me that, you also go to different areas in the country and you may be meeting a lot of people like us in the villages in India, don't you? So that is where, for me, that question of scaling up comes. Because scaling up is not about just expanding an intervention or just increasing coverage of that intervention. It involves very complex building up of capacities at all levels, changing capacities, changing policy norms, and also empowering people to sustain that change. It's a tall order, and we all aspire for it. I mean, every organization, I think I can say, who's working in this sector or any other sector wants their program to be scaled up. But we all kind of grapple with it, even with defining it, we grapple with, and also operationalizing it. So here I would like to talk about an initiative. It's been talked about in the morning, but I'll talk about it from a different perspective. The DAC 10 to 19, how we have integrated and how we are trying to make some enablers within our program which will help to scale up that initiative. So I start with a very brief background. The background has been given in the morning, but it all started with the 2013 initiative when USAID, Dasra, Kiawa Trust and Piramal Foundation, we started the Dasra Girls Alliance. And Dasra Girls Alliance did some fantastic work, as you may have heard earlier also, on actually showcasing some of the issues that impact the adolescent girls in India. There were a number of research reports brought out. Nearly 3 million adolescents were reached and 28 million was actually got for the sector of adolescent girls. So this was fantastic fantastic work that was happening. Girls are fantastic, of course. Sorry. So, but then we wanted to take it to the next level. We actually wanted to bring the learnings that were in that program into a cohesive form to have a greater impact. So we had a lot of meetings, discussions, met up with a lot of stakeholders, met up with youth groups. I mean, whatever are the usual things we do in this sector, we did that. And then we defined the collaborative, and I'll just talk of few strategies that we are taking in the collaborative to take it further. So one of the first things that we started with is having a high-level common outcome framework. And when we define the outcome framework, we realized that adolescents don't live in sectors, they don't live in health, they don't live in education, they don't alone live in empowerment. So their lives cut across all these sectors. So while defining these high-level outcomes, we actually articulated outcomes which related to education. Completion of secondary education was one. Early marriage was another one. Delaying first pregnancy was another one. And a broad outcome of actually looking at issues of equity and equality and empowerment was another one. So these 4 outcomes was kind of a vision for the collaborative. So in one way, it articulated what should be there for adolescents. On the other hand, it also articulated what as a sector we want to see. And then within that, I may be maybe one organization which is working on a small piece, and I can contribute to that small piece, but all of it is towards a larger initiative. So having that vision was very important for us to start with. The second thing which we wanted to foster, and we are trying to different initiatives within the collaboratives, is fostering of learning and sharing. Now, it is not that we don't learn and share within our programs. We do excellent programs. There have been examples of great programs which have really showed evidence-based results. These programs have also been disseminated and shared. But what we probably don't do is actually learn from this program and not to reinvent the wheel again and again. So that's something which we wanted to promote through this collaborative. So learning and sharing was another initiative, and how we are doing it is that on one hand we have a demonstration model which has got implementing organization. You heard in the morning Quest Alliance, CINI, C3 and Angan Trust, which are implementing across 10 districts in the country. So there is a cross learning between these partners. They share resources, they share materials, they talk to each other, and they meet often to take their programs forward. These organizations have also been doing programs earlier, but I think this forum is a great opportunity for everybody to collaborate. The second initiative within this learning sector is the community of practice. The community of practice is actually a network of 60+ organizations which work on issues of adolescent health. It's a learning sharing community, and the community is actually taking it one step beyond the learning into advocacy initiatives where they actually advocate for some of the issues which impact the lives of adolescents. The third important aspect of the collaborative is rigorous data measurement. The rigorous data measurement is usually an important part of all our program, but here we are looking at it two ways. One is to use it as an evidence for advocacy, for scaling up. The other part of it is actually tracking the data to see that, whether we are going, where we are going, are we going in the right direction? And having some correctional measures in case, we are not reaching where we want to reach. So learn fast, fail fast. Those are, the things which are using, because we don't have the luxury in India of spending 10 years on a program and then learning from that program and then redesigning. So we learn while we design probably. So that's another important aspect of the program. And this also helps us to articulate. Just to give an example, the implementation is rolling out in 10 different districts of India. But when they measure their outcomes, again, common indicators, it's more effective, and it's better said when we collate them and present them to any forum, and becomes a good advocacy tool for scaling up. The fourth thing, which actually these are not in the order of priority, I want to do that disclaimer because actually the fourth thing maybe should have come first, is placing adolescents at the center of the programming, not just as the beneficiaries, but also as the designers, planners, implementers of the program to inform what is happening on the ground to the program. So adolescents, and I take it as a whole community, the people that surround those adolescents, because many decisions, as we heard in the morning, taken by the adolescent girls are not actually their decisions. It's governed by so much which is around them. So for those communities, we want to see what works. So what works, it can be something which can be leveraged from the public sector. It can be something which can be leveraged from the private sector. It can be leveraged through philanthropists or whatever, but the centerpiece is what works for adolescents to increase their access to information and services. And the last thing, which actually is not the last thing, but I think no scaling up is possible without, ignoring the greatest scaling up machinery that we have in this country, which is the Government of India. So the program works very closely with the Rashtriya Kishore Swasthya Karyagram, or the government programming in India. In fact, Dr. Zoya, who is sitting here, has been associated with us very closely, even in the co-design of the initial phase of the program. And now the program has started rolling on the ground, and we really look forward to their support. In short, what I want to say is through making all these efforts and making them together, we really want to improve the world for adolescents in India a little bit more. Thank you.